Welcome to LGBT Health Matters. This is a guide for healthcare professionals on working with lesbian, gay, bisexual and trans people. We begin by looking at some of the presenting issues and also some solutions. First up is an interview with Professor Mark Petroni, the Director of Public Health at South Gloucestershire Council.
In terms of the LGBT community, I think some of the strengths are that they're often more actively engaged in thinking about their own health than many other parts of the community. They're more aware of their health issues. They're more likely to look for help, seek help. There are often support groups available, peer groups, and things like that. I think one of the other issues is that because of the stigma and discrimination and trouble that members of the LGBT community have in accessing services, or perhaps a fear sometimes of being treated differently or being stigmatised, they feel that if they walk into mainstream health services, they will be marked out and stigmatised. And that is a problem, actually. And some of that discrimination is unintentional from the health services perspective. We're not very good at times at creating an environment in which LGBT communities feel comfortable.
Next up, we go to the Armadillo Youth Cafe and visit our LGBTQ youth group. We speak to the young people there about their experiences of accessing health.
So what's your experience been like with your doctors and things?
I think sexual health is the most awkward thing for me, to the point where sometimes I almost don't want to go, because the past 2 times I've gone, just because I've liked to sort of generally check up every 6 months, because it's the good thing to do. They don't, because I'm trans, there's always that awkward talk of, oh well, do we test you for the men's one or the women's one? And it's really, really awkward because no one kind of knows what to do when you're trans, and I'm like, well, I don't know either, and it can sometimes be a bit awkward. I've not had so much them being negative towards me. It's more almost a lack of understanding of what to do for a trans person that comes in and wants to get themselves tested. I think there still needs to be a bit more education there, so that when a trans person does come in and goes, oh, I want to be tested, there's more, they understand what to do, the right things to say, what they're meant to do, so they're not kind of sat there going, oh, I don't know what to do, let me just run off and ask this person, that person, this person.
And then of course there's a lack of knowledge in terms of health professionals, and it can be quite complicated because you need every member of the team to be as aware and as supportive. So you can have a very understanding and supportive and aware doctor or nurse, but if the receptionist is different, or the receptionist, it can be the other way around. All of this adds up to a sense of isolation and reduces, I think, at times people's health-seeking behaviour appropriately.
From my perspective, certainly going within my kind of adult life now, one of my gripes and bears are when you go to the GP and you say, my partner, and they'll always assume she, actually it's a he. That's one of my biggest gripes with any professional service, particularly GPs. I don't think there's enough information on healthcare out there for the LGBT community. I am afraid to go to my own local GP to talk about any kind of man issues around kind of gay sex, but it's then trying to access where that information of who you can go and speak with, or where that facility is. If you're too afraid to go to your own local GP, where do you turn? Unless you've got the friends that have been and know, actually, Dan, there's a good clinic there, go to that one. You're kind of stuck, left in this little bubble, thinking, well, can't get the information I want, should I even bother? So that's one of my main concerns is, again, the education and the information. I don't think there's enough out there.
Now, we want to look at moving forward, and we spoke to a GP working in primary care about their experiences supporting LGBT people. We also spoke to an LGBT young person about their experiences of accessing health.
The issues for LGBT people in this area are very important in primary care in general. I believe I'm very proud of this country in that we're a very diverse nation. with that diversity comes responsibility, and responsibility to be equal for everybody. Everybody's equal. And therefore we must ensure that for LGBT people, they have equal access to NHS resources. As a GP and working in primary care, we have a responsibility to ensure that our patients have equal access no matter what group they come from. As a gatekeeper to the NHS, I feel that is very importantly my role. Of course, there are issues that are particular to LGBT people, and we must make sure these are covered as well during my work. But equality of access is absolutely critical.
The less you understand about people, the less sympathetic you tend to be towards them. Going back to the GP and doctors and such, I feel like there should be more training, and I think it should be compulsory when, you know, going to medical school or, you know, whatever, that they should have to kind of, you know, learn about this. I think this is why we need to kind of humanise LGBT people, and people who don't have so much information about it need to realise, or need kind of workshops and things of this nature in schools and such, to realise that these people are human. They have feelings. They, you know, they're going through a lot on their own mentally, and, you know, there's 100, for every one thing they're saying, there's 100 things they're not.
I think we all have a lot to learn. Even asking me that question makes me reconsider how I approach people, and we could all do with more training. And I think that I would appreciate that myself.
We want to look at training and the importance of staff awareness in relation to LGBT people when delivering healthcare. We spoke to some of the people that work with us in delivering that training.
I think one of the big issues with any sort of training that gets done is that you need the class needs to come out of it having respect for the people that they've been trained about. The thing that I really like about the training that we are doing here in Bristol now is that we're actually putting trans people in front of the class, getting those trans people to tell their own stories. And I think that's enormously powerful, because the class gets to meet actual trans people, to hear about them, to hear their lives and their own stories. And mostly we don't talk about ourselves, because the class isn't there to do that. They're there to learn about the medical issues, about the legal issues, and so on and so forth. But because they've met us, and because they will occasionally have a little chat over coffee or something like that, they then have a relationship with trans people. They have met trans people, they know what trans people are like, and we're not scary anymore. We don't have two heads. And we don't need to be in asylums or anything like that. We're just ordinary people just like them.
So thinking about, in terms of education, having a wide lens of knowledge, so about not presuming heterosexuality, not presuming someone's gender identity, and also as well that professionals feel confident and able to keep up to date with kind of changes in practice, and also particularly pertinent issues affecting specific communities. Whether that be within sexual health, emotional health and well-being.
Culture change and best practice are really important ways for improving the experiences LGBT people have when accessing healthcare. We spoke to a local GP working in primary care about their ideas on culture change, and asked the people that took part in this film what their message would be to healthcare professionals.
I think probably the thing that has changed is I think attitudes are changing. I think people are becoming more open, and I think there's a real willingness to learn, and I think that's something new, so that even if people don't always get things right, they're trying, and they want to make people feel welcome and included, and I think that's a real strength, and certainly working in the teams that I do, that's something I see in all my colleagues as well.
What would your message be to me as your doctor, if I was your doctor?
Have more information. Have information on the relevant subjects, not just isolated to whether you're a gay man or a lesbian woman, but have the information for every possible scenario, and with the variety and uniqueness that we now have in this world, to have an open mind and just to listen to that young person and be there to support them.
but there are ways to keep improving things, and I think one of the routes that we use is discussing with the Clinical Commissioning Board, the CCG, and looking at what can be offered and what ideas we can come up with, and that's often a route into service improvement. And we are seeing that with other areas at the moment, and so I think if there are good ideas, they can be taken there and hopefully pushed through.
You know, if you're a GP, I think you should know about where all the gender clinics are. I think you should know about the information. I think you should go and look up all the terms. I know it might be a lengthy thing, and a lot of GPs may be like, oh, you know, that's a lot of homework, but I definitely think that it's something that really would be worth doing, just knowing all these terms, educating yourself, knowing where all the support networks is, having all that information could make such a huge difference.
I think there is work around what our ideal scenario would be, and in that ideal world I would want every patient coming through the door of our surgery to feel like they were going to have a positive experience, and that they were going to be talked to respectfully and in the way that they wanted to, and have an understanding conversation with whoever they talk to, whether that's the receptionist or our nurses or myself. And I think that's what we need to be striving for, is inclusive healthcare. As part of having worked in the NHS for a decade, what I believe in is free and equal healthcare, and that's what I want to be doing here.